This is not an ordinary cough. It is tuberculosis TB. TB affects all ages. However, childhood TB may be detected late because those affected depend on their parents and guardians to act. In 2021 alone in Zambia, about 8,400 children aged 0 to 14 fell ill with TB. Dr. Mutumwa Muyangana, currently working at the Center for Infectious Disease Research in Zambia, is involved in the care of people with TB and part of the team implementing the USAID Tuberculosis Local Organization Network project.
When we talk about exposure in a child, it may be from a parent, a mother or a father that may have the TB. It may be from a nanny, it may be from a teacher, it may be from any adult who has TB who they come in contact with.
According to the World Health Organization, TB is one of the top 10 causes of death across the world, and Zambia is one of the 30 countries with the highest burden of TB in the world. Dr. Mutumwa Muyangana now explains in detail.
One thing about children that we should note is that children play very near adults. So a child will play on an adult's laps. So when we talk about exposure in a child, it may be from a parent, a mother or a father that may have the TB. We are seeing a number of TB cases in children. However, we still have a very big gap in terms of the number of the children that are actually developing TB in our communities, and those that are getting diagnosed with TB, and those that are actually being put on TB treatment.
I'm exploring childhood TB in Zambia. I reached Kalingalinga in Lusaka, where I was privileged to speak to a couple who have a 6-year-old boy who got infected with TB. When did you know he had TB and how did you find out?
I'm now 6 years. I think
my son is 6 years old and has TB. I think I found out at the beginning of the year. How I knew he wasn't well is he would have very high temperature and had no appetite. He also used to say his legs were feeling hot, so I called his grandmother where he had gone to visit, and I was told to consider taking him to the hospital for a TB test. My sister helped me with taking him to the hospital, and we waited a week before actual results were given to us. We got the instructions and he was started on TB treatment immediately.
Then payana konkapo manje whereby because they're supposed every month kwendo tenga mankwala ndipenda shita continue in manje kufika manje.
The mother here conquered myths and misconceptions about TB. The stigma and discrimination associated with TB has kept many, including parents, from taking their children to hospitals to seek medical care. Government is aware of this challenge and lists it as a source of concern. I spoke to Ministry of Health Chief Community Health Officer Wanga Zulu.
If you see a child being brought to the hospital with TB, most of the time, it means that child is nearing the grave. They bring the children when it's too late. People like self-prescribing medication. Adults out there, TB can also affect a child. Coming to have access to TB services, I'm appealing to the general public. If you have a child in that home, let's carry them along. All of them are going to be screened, no matter how small the child is. We are able to do what is called gastric lavage. We are able to collect specimen, and that specimen will actually be analyzed to see whether the child has the disease or they don't. And if they don't, the child is put on TB preventive therapy.
Generally, TB has been associated with HIV. Some people think anyone with TB is also HIV positive. Agre Chibuye is Community Mobilization Advisor for the Tuberculosis Local Organization Network project and now clarifies.
One of the risk factors is a weakened immune system. HIV is one of the conditions that weakens the ability for the body to fight off diseases. One of the opportunistic infections that arises because TB is in the air as we are going, as we are moving in the buses, as we are in the church, in the choir singing, we are exchanging the bacteria which is in the air. And if you have HIV, you are not on treatment for HIV, for instance, to strengthen your immune system, one of the most common opportunistic infection that you might have is TB. Basically, the relationship is because when HIV weakens your immune system, TB will creep in. But I need to mention here that not all people that have TB have HIV. TB, you can also have it even when you don't have HIV.
Medical experts say TB is both curable and preventable. However, the country still records deaths associated with TB. Dr. Muyangana tells me why.
We still have a lot of misinformation in our communities about TB. People tend to look for other solutions before they do present themselves to the facilities. Somebody has a cough for an extended period of time, they've been to the facility, have received usual antibiotics that they receive, and the condition is not improving. Usually what we see in our communities is that we tend to look for solutions outside of the healthcare system. And because of that, we tend to have people who are presenting late to the facility, and then that gives healthcare workers very little room for intervention. However, if people present themselves to the facilities early, they, one, break the cycle of transmission, meaning you reduce the number of people that come in contact with that person and are therefore at risk of getting TB, and you also improve the outcomes of that particular person that has TB.
As for the couple taking care of a 6-year-old with TB, they have a word for fellow parents who may be faced with their situation.
I
would like to encourage fellow parents who have children with TB to be strong and be consistent with administration of medicine. Parents shouldn't be shy, but rather they should be proud of their children so they can also motivate them to take their medication for them to get better.
So sitifuna kumvera nsoni tifunga chettako nkama instruction kwasira nishiviza nkhala bwino vindu
kaili matenda chiaziwika kuti yabwera bwanji.
We can't tell how some health conditions come about. TB can be contracted through many ways. TB also affects those with HIV and others who may have weakened immune system, according to what I've read on Google. So parents should be proud of their children and seek medical intervention in good time.
In short, when I go on Google, when searching, nivambiri venaona. Ingacha na oputanga as a post, otherwise never ngalambeko.
Agre Chibuye, Community Mobilization Advisor for the Tuberculosis Local Organization Network Project, explains the role of the community in combating TB.
TB is found in the community where we have people that are converging, where we have people living in small spaces with poor ventilation. Now, when you have somebody who has TB, it is important to provide adequate care. Whilst as from the health perspective, care will be provided in the sense of diagnosis, and this person will be put on treatment and they will be monitored. The family members play a critical role to ensure that this person is adhering to treatment by reminding them to take their medication, ensuring that where this person who has TB, the place where they are is well ventilated. Ensuring that he's being encouraged, or the child is being encouraged to eat and to take their medication, but also to speak positively. We have a lot of misconceptions about people that have TB, and we tend to run away from them.
The reported 8,400 children infected with TB in 2021 alone challenges parents to have their children tested for TB whenever they present with TB symptoms. Reporting for Christian Voice News in Lusaka, I'm Michelo Hachizibe.